Well, a day after the health department said government is negotiating with COVID-19 vaccine manufacturers to get supplies into the country as early as next month, the frustration continues. When the vaccine is secured, a massive rollout program would target 67% of the population of the country, or about 40 million people, prioritizing health workers and the vulnerable. The briefing came days after a group of health experts criticized government for dragging its feet on a vaccine and lacking transparency. Professor Guy Richards from Wits University was among those in the group. He joins me now. Professor, thanks indeed for your time. I want to continue with the debate as it continues today. You had the Ministerial Advisory Committee on Vaccine Development standing firm on the argument that making a pre-purchase on some of these vaccines would have been too risky. There was money losses that could have been incurred here on the one hand. On the other hand, they say one of the vaccines were probably not even suitable for storage. What do you make of that continuing stand that the committee has?
Well, that's obviously nonsense. It's a cover-up. It's the ordering system or the mechanism that had been developed in order to order these vaccines allowed people to pay at a later stage if and when the vaccine became available and if and when it was shown to be effective. So this was actually prior to the development of the vaccines. It's complete and absolute nonsense that there would have been money lost at that time as well. It is true that there are storage problems for the Pfizer vaccine in particular, which requires to be stored at -70. But even there, already, there are developments in terms of companies that would be able to supply and a certain amount or freezing systems for a certain amount of the Pfizer vaccine. Because that ultimately is what we would have to do. We would have to now order from multiple sources, not only one. And at least some of the vaccine could be sourced from Pfizer and could actually be kept at -70.
I want to talk about inoculation for a moment here. Let's assume we get the vaccines in our favor by March. I'm wondering whether or not we have the infrastructure, the competency and the conditions to actually reach this perceivably very ambitious target of inoculating 40 million people by the end of the year. What's your take on the conditions as it stands?
I think that that's a very good question. Worked out, it would mean that if you were to get your 40 million people who are vaccinated by the end of the year, starting in about April, you'd need to vaccinate about 148,000 people a year. A day. And I'm not sure that we actually have that capacity currently. Having said that, one would then involve multiple different organizations. It couldn't only be managed through the government. It would have to be managed through large corporates, for example, Pick and Pay, Coca-Cola, Dis-Chem, Clicks. You'd have to involve all of the various means that would be at one's disposal to actually try and get it out to as many people as possible. Our argument is that the very first group would be those that are most at risk, and that means the healthcare workers that are bearing the brunt currently of the COVID and have had a significant mortality and obviously morbidity, in other words, illness from COVID itself and absenteeism. So given the numbers of patients that we currently have, we actually need to get them vaccinated first and then work out systems over the next month or two as to how we would manage to distribute them effectively. I'm not sure that we'd manage to get the true number or total number done by the end of the year, but we could make a very good effort of it.
All right, so let's just stick for the moment with a solution here. So the AstraZeneca Oxford vaccine appears to be the one that's the most promising. No stringent storing conditions, and I believe it does cost, it's less expensive. What's your take on how we should move further? Should we choose this particular vaccine?
Well, first of all, we have to negotiate an agreement with AstraZeneca, which wasn't done.
Yeah.
This was critically important that we are able to now set up some form of negotiation that will free up some of the vaccine available to us. If we haven't got any available in terms of the numbers which are potentially able to be manufactured and the numbers that have been pre-ordered, well, then we have a major problem. But still, it is possible that through the back door we might be able to order those. If we do, then we need to set up an enormous logistics operation run by probably a private sector system, whereby one would have a distribution czar who would be able to ensure that the actual process functioned in an efficient way.
All right, we're going to have to leave it there. Professor Guy Richards from Wits University, thanks very much indeed.